The next key narrative, basic income can address the public health crisis. So we already kind of covered this too with the other ones in regards to affordability and stuff. But yeah, financial insecurity is a leading contributor to poor mental and physical health. Basic income directly addresses this, providing a stable financial foundation that reduces stress and anxiety. By preventing stress related illnesses and promoting healthier lifestyles, basic income leads to substantial savings in healthcare costs and improves overall societal well being. As a preventative public health measure, basic income tackles the social determinants of health, such as poverty and inequality, reducing a long term burden on the NHS and social care systems.
Yeah, it's a little bit like to me, like they say school outcomes are like 30% determined by what goes on inside the walls of the school and 70% determined by what's going on at home.
Right.
And so just blaming the teachers for everything is missing the forest for the trees. One very poignant interview I had early on in Bootstraps was someone from Canada who was talking about, I think an interview they did, but with Canadian doctors who said they absolutely preferred being able to work in a universal healthcare program or a system, but they still a lot of times wish they could just prescribe cash. Like cash is the best preventative medicine. Like a lot of the times people don't end up going to the doctor or eating healthy or going to the gym or whatever because they can't afford it, they don't have the time, whatever. We have a much healthier baseline when people have the financial power to make the healthier decisions.
Yeah. And it's not only about poverty either. And it's really inequality, insecurity. These things happen to those above the poverty line. And so all these programs that focus only on poverty don't actually address this. Like the best way to actually improve health is actually by getting at that insecurity and that inequality by reducing both of those. And you can be in the middle class, you can even be considered rich by other people. And if you lack that security because you're always wondering, like, I could lose my job at any point, I've got to get as much money as I can. I've got to, hoard. We talked about that before. This insecurity can lead to this kind of hoarding behavior and greed of wealth accumulation just because of wondering, worst case scenario, what happens? I don't want my family to live on the streets. So even though I'm earning six figures, I'm really worried that can disappear at any moment. And then that actually leads to like heart disease and stuff.
Yeah, that trickles up, not just the cortisol, but the reality. If you live in a world where zero and destitution are possible and actually somewhat prevalent, like you can see the path there, even when you're well off, you're in defense mode. You're like, which puts you in hoarding mode.